Hi, everyone. Welcome to this Wellspring Cancer Support Nourish session on managing eating-related side effects. This is one of a series talking about different side effects that may come during cancer treatment, and today's topic is on having a sore mouth. My name is Kara Rosenblum, and I'm one of the Wellspring dietitians, and I will be taking you through today's presentation. Before we begin, I want to give you some information about where our information comes from. And it's always really important to know where this comes from because there's so much misinformation out there these days. So rest assured, here at Wellspring, we only use the best, most up-to-date science and evidence-based information. We rely on information from the Canadian Cancer Society, the World Cancer Research Fund, the American Institute for Cancer Research, the National Cancer Institute, and of course, any updated studies that come out from renowned institutions from all around the world who are studying cancer. So some people will find that when they are going through cancer treatment that their mouth becomes sore and may be wondering why that is. Well, the medical term for this is called mucositis, and it's when you have mouth sores or swelling inside your mouth or your throat, which can make chewing and swallowing be sore and problematic. And this can be caused by some cancer treatments, including chemotherapy, radiation, or stem cell transplants. You may be wondering, why does it matter? Well, having a sore mouth overall can reduce your appetite and make it harder to eat and drink. And this is problematic because many people who are going through cancer treatment do start to lose some weight. And we want to keep weight at a manageable level so that you feel strong and you feel good. And a sore mouth can, do the opposite and lead to a decrease in your appetite. So we want to make sure that if this is an experience that you are having, you know that it can be treated so it's less painful. It's really important to know if this is bothering you, let your doctor or dietitian know what's happening because they can recommend a medication or often a special mouthwash that can lead to relief of the sore mouth and bring your appetite back so you can maintain a good, healthy weight during cancer treatment. So talk to your doctor or dietitian about medicines or mouthwashes. And in the meantime, some of these tips can help if you're suffering with a sore mouth right now. These are the nutrition tips you can follow. So it is helpful to choose foods that are cool or lukewarm rather than foods that have extreme temperatures of being very hot or very, very cold. These lukewarm or cool foods are just more gentle on a sore mouth and don't tend to be as painful. You also want to eat softer or bland foods, so nothing with sharp edges. It's not the time where you want to have a sharp cracker or something that could cause pain into the particular sores in your mouth. So soft, bland foods include things like scrambled eggs or tofu, warm cereals like oatmeal, congee, or porridge, things like bread, rice, pasta, potatoes, things that are soft and bland are very, very helpful when you have a sore mouth. Soft vegetables and fruits are good too. Applesauce, things like squash or peaches that are very ripe and you can mash them or they fall apart in your mouth quite easily. Banana, avocado, melon. So that's going to be easier to chew rather than something like an apple, which is quite crunchy, or an orange that's quite acidic. So you want to stick with these sort of bland, not acidic, easy to chew foods. Dairy products are also helpful. Things like yogurt is very smooth and cooling. Cottage cheese is good, milk. But again, you don't want to take it right out of the fridge and have it. You want to give it, 5 minutes just to come down to room temperature before you have it. Nut butters are also great. They're smooth, spreadable, and pretty bland. Or spreads made from beans, such as hummus or black bean dip, not a spicy one. Those are going to be very, very easy to digest. They won't have a lot of acid that's going to hurt any mouth sores. When looking at beverages, there are also some things you can do to make yourself more comfortable. Again, you want to avoid very, very hot drinks. So you don't want to pour a hot cup of tea and start sipping it when you have mouth sores. And you want to avoid very cold drinks. So something like a milkshake or a smoothie, you want to bring it down to room temperature before you drink it because it's going to be cold and that can irritate mouth sores. You can also try soups once they're not boiling hot, smoothies and commercial nutrition supplements. So an example of a commercial nutrition supplement is something like Boost or Ensure. You can get these at any drugstore or grocery store, and they're high protein beverages that you can enjoy. And they are also want to be sipped, not right out of the fridge. So just wait a few minutes until you start sipping. If you are a juice drinker, you want to make sure that you're choosing low acid varieties. So orange juice and grapefruit juice are out. They're too high in acid and can irritate your mouth. You want varieties that are more of a nectar, like peach or pear or prune. They're going to be much easier on your mouth. You can also try drinking with a straw so that you are controlling exactly where you pull the juice in and swallow, easier than taking a big sip through a cup. And you also want to avoid alcohol, which can cause a burning sensation in your mouth. In terms of textures, you want to make sure that you're cooking food until they're soft and tender, so you can mash them easily or you can use a blender if that helps. You want to cut your food into smaller pieces than regular so that you really have control of where the piece of food in your mouth goes, especially if you know there's certain areas of your mouth or your throat that have sores, then you can have a small piece of food and chew it slowly. You can, as I said, use a blender, or you can use a food processor, or you can mash or puree foods and make them soft to the touch of your mouth. And then you want to limit foods that are very tart or acidic, things that are extremely salty or spicy. Anything that's rough at the edges, like potato chips, crackers, toast, pretzels, tortilla chips, that would be salty, and it would also have rough edges that could cause cuts in your mouth. You want to avoid that. And you also want to avoid food that's very dry or very crumbly. So again, things like crackers or toast, because that, again, when it's dry, you don't have as much control as to where it lands in your mouth. So you want to be careful with that. Another thing that can help is rinsing your mouth often. There are different rinses that may work, but the best thing to do is ask your healthcare team to recommend mouthwashes for you. They're going to probably give you options that are alcohol-free because, as we said, alcohol can be an irritant when you have sores in your mouth, and you want to get a mouthwash that can soothe your sore mouth and sore throat. So your healthcare team will have names of specific mouthwash that are right for you, that won't interfere with any medications, and that'll be a perfect fit. If you want, you can also make your own mouthwash at home with a few shakes of salt or baking soda mixed with water or club soda. But again, if you find salt is irritating to you, check with your doctor before you try this, and see if they have a specific alcohol-free mouthwash that they recommend. Thank you for listening. I hope some of these tips were helpful and hope to see you again at another presentation.